Hi, my name is Samantha Willis. I'm a nurse practitioner student at Auburn University. Today I'm going to be doing a suture demonstration on 5 interrupted sutures. So to begin our process of suturing, I would complete hand hygiene and ensure all of the proper supplies are in front of me. This includes our suture pad, needle holders, scissors, tweezers with teeth, and for this demonstration I'll be using nylon sutures. So in our initial assessment of the patient, we want to obtain a baseline status, assessing blood flow to the site of injury, getting a good past medical history, noting allergies, and determining how the patient obtained the injury. After this assessment, we want to irrigate the wound with normal saline or tap water and ensure that all foreign bodies are out of the site of injury. For this demonstration, I'll be using this laceration here at the end. We then want to anesthetize the area using a local anesthetic, so we'll use lidocaine 1%, and if it's the appropriate location, we can also add epinephrine to vasoconstrict and decrease bleeding to the site of injury. Areas that it's not appropriate to use epinephrine would be fingers, toes, penis, ears, or nose. If the area is a larger wound, we can use bupivacaine because it has a longer lasting effect. So to administer the lidocaine, we would insert the needle bevel up subcutaneously along each side of the laceration, and we could even go inside of the site if it was appropriate. Selecting the proper suture depends on the body part it's being used on, so we want to use the smallest suture possible to have the least amount of scarring. For a trunk injury, we can use a 3 to 4, extremities or scalp we can use 4 to 5, and for face 5 to 6. We also want to determine if we're going to use absorbable versus non-absorbable sutures. And if at all possible, we want to maintain sterile technique the entire time we suture. So after cleaning out the wound and injecting lidocaine, we're going to take our nylon sutures, we'll clamp the needle holders towards the top and turn it 90 degrees to the skin. We want to try and have an equal insertion and exit point and make sure that we are able to get the dermis. So we'll leave about 1 inch to 1.5 inches of the suture on the back end. And then we're gonna wrap the suture twice. And pull it into a square knot, making sure that we don't pull it too tight where it could impair wound healing. And then go the opposite way, and we'll do that whole process twice. Get that tail out of there too. Around the other way. And we want all of our knots to be to one side. So then we'll trim that point. And we can kind of trim this one down as well. So we want to start in the middle of the laceration and then move to the side. We want to have equal spacing between all of our sutures. Again, 90 degrees to the skin, making sure we get enough skin on either side of the incision. Getting it deep enough to get it in the dermis. So wrap twice. Pull it in a square knot. Pull that knot to one side as well. Trim both sides, and we'll do one final suture on the right side. Pull that knot to the right side. And trim that as well. Then we'll move on to the left side. And we have one final suture on this left side. sure all the knots are on the same side and everything is appropriately trimmed. So for post-laceration wound care, we want to ensure that the patient keeps the incision covered and dry for the first 24 hours. And to decrease the amount of scarring, we want to educate the patient to keep the sutures in for the least amount of time possible while also ensuring that proper healing happens. So if the sutures are over an area that moves a lot, such as a joint, we will increase the amount of time that the sutures are kept in for. For the face, we want to keep the sutures in 3 to 5 days, but for the scalp or arms, we would keep them in for 7 to 10 days. We want to educate our patients to return at the appropriate time for removal. However, if they notice any signs of infection, to report back sooner. When the patient returns to the office for removal, we want to check for any signs of infection or failed wound healing and adjust our care plan from there.